from our website. We reached out to you, a new job, emails, and then our newsletter. Great. It seems like there are a number of different streams where people are hearing about this call. So continue to type in your answers. We'd really like to know more about where people are learning about our community calls. And we also want to see where folks are calling in from. So if you go to the left-hand side of your screen, you'll see an arrow. Click on that arrow, then click on the map to select the state where you're calling from. So I'll click right over to Massachusetts. Great. So we have people from the West Coast, the East Coast. Like I said, I'm in Boston. We have some folks in South Carolina, North Carolina, Patty's in the DMV area, Washington State. Great. It looks like we have a great group with us today. Awesome. All right, so like I said, my name is Naomi Fed, and I'm the project coordinator for the Conversation Project, and I'm going to hand the ball off over to Patty, who's our improvement advisor. All right, Patty, I pass you the ball.
Thank you, Naomi. I was sitting here talking to myself, not realizing I was on mute. So welcome, everybody. I'm excited to see we've got a heavy East Coast contingency, but we also have some West Coast attendees. So I'm just excited to see everybody on the call. We have a great call today, and as Naomi mentioned, I'm Patty Webster. I co-lead our community engagement and learning work, and this call is part of a series of calls we have on a monthly basis, open up to anyone who has been exposed to the Conversation Project and beyond, anyone who's interested. So it's a really open call. And as Naomi mentioned, we want to encourage those that are on your computer to chat in. We're really informal in our calls, so we want to make sure we get use out of that chat button. For those that are on the phone, I apologize that we won't have that chat button, but we hope this brings a lot of really good information and learning to you all. So I'm going to run down a little bit about what we're going to do for the next hour and a half. And we've got some really exciting folks that are really going to be the main meat of our call today that I'm going to get to pretty quickly. So for now, I'm going to do a little bit of framing and just a little bit of background about this call and what this is all about. As you know, this is all about community organizing and working together. So after I do a little bit of framing, I'm really going to jump right in and introduce our three speakers. We've got some fabulous examples from grassroots organizing, citywide coalition building, statewide organizing and coalition building. So we're excited to learn from the experience of these three groups. In between presenters, I'm going to make sure we have a little bit of time for questions and answers right after the presenters go. But at the end, we're also going to loop back around and have more time for open discussion. And so it's really an opportunity, as we like to say at the Conversation Project and the Institute for Healthcare Improvement, we are an all-teach, all-learn environment. So we know that folks on the call may be bringing a lot of experience and questions to the table, so we want to give time for that open discussion. And then I'm going to just share some additional resources that you can take home, put in your pocket, and potentially take out and use in your own community settings. And then we'll wrap up the call and share a little bit of it next steps. So that is our agenda. And as I mentioned, anytime you have a question, an idea, an insight, go ahead and pop it over in that chat button. And so I'm going to get us warmed up a little bit further. What I'd like to do is I see some folks calling in from all over, and I love the spread across the U.S. We have some folks in Texas. Garrick, it's fun to see you here. I'm glad to see you on the call. What I'd love to learn is what brought you to this call. So as we frame the next hour and a half and our presenters frame what they're speaking about, it'd be great to hear what you're hoping to learn. So did you come to the call for general learning? Maybe it's a burning question you want to explore. Maybe there's a challenge, a particular challenge that you're hoping to find some answers for. Or you want to share what's been successful in your neighborhood or in your region. So just maybe give us a little idea of why, what brought you to the call. And then let us know what experience you have with building coalitions or joining forces with others in your neighborhood, in your city or county and region. Maybe you're new, you're just starting to think about this, maybe you're seasoned, you've been doing this for a long time, and you're hoping for some fresh ideas. So just let us know if you're new, seasoned, or somewhere in between. I'm just going to pause for a second and just give folks a chance to chat that in. So go ahead and send that to all participants. Great. So Garrick noted that he is doing some city engagement and learning about engaging within your city. So I know, Garrick, you're calling in from Austin. That's fabulous. Andy's saying that he's grateful for the partnership that Reimagine has with Conversation Projects and looking to give back. So Andy's going to be one of our presenters today. So thanks, Andy. We're excited to have you here. Lindsay notes she's building a new coalition, looking forward to hearing from others' experiences. Great. Well, we hope this will give you some 101 first steps for you, Lindsay. Elizabeth also noted she's starting a new program in the hospital. Fabulous. I like to hear also, it's nice to know whether you're in the community side of things, in healthcare. So Elizabeth, I think we'll have a little bit of everything for you because we've got some community groups and healthcare-based groups that are going to share today. I see some other folks that are reasonably new. Beth, it's good to see you, Beth. I see some medium experience. She's doing her first 2-session presentation tomorrow, an educational program at a church. Well, that's exciting. We're looking forward to hearing how that goes, Beth. So you can hopefully take some things away and then share with us some ideas that you have from your experience. Matt's hoping to get this started in this county. Eleanor, welcome. She's a new director of Honoring Choices Virginia. So welcome to your new position. That's exciting. I think you'll have some good takeaways. Diana is looking to continue to work on building a coalition and wants to hear from others' experiences. Yeah, you've got some great experience, Diane. So I would love to hear what's resonating and anything you can add to the conversation. Priyanka is mentioning that she's looking for general and shared learning. So she's from Valley Medical Center in Washington State. Wonderful. So we've got some Washington examples for you, and so hopefully we'll make some connections between you and Mickey's work. Super. So I'll come back here. I see a lot of people are looking to share some at the beginning. Some are looking into sustainability, some of our presenters. And I note that Marisette's looking that there's always something to learn. And we're in that same mindset. So keep this going. Naomi's going to help me take a look at what everybody's typing in here. I'm going to keep moving on, but I really appreciate everybody mentioning kind of where they are and what they're hoping to take out of this. We definitely see some significant experience here and some newbies, so we'll hopefully have a little bit for each of you. Great, thank you guys. And as you go along, go ahead and continue to pop in any questions as something pops to your mind, and we'll get to that as well. Okay, so for those of you that are new, and if you are not completely familiar with the Conversation Project, this is just a little bit of background on who we are. And for those that know, we are a public engagement campaign that's really dedicated to assuring that everyone's wishes for end-of-life care are expressed and respected. So expressed early and often before a medical crisis happens, and then respected when the time comes. And so we are working in harmony both with community and healthcare. This is a joint, we call this our double helix model together. And so in the work that we do, our strategy for creating what we call this cultural change really is rooted in community organizing. We have a 3-pronged strategy that we are hoping to achieve that aim that I mentioned. The first is we're really building awareness, and we do this through stories. Our whole bit of work started through storytelling. So we want to get the word out. We want to normalize this conversation. We build awareness through social media, working one-on-one and face-to-face interactions and engagements, but really want to get the information and awareness out there. We know that that's not enough, so we want to ensure that this is accessible, and we want people to come away and have tools in hand for action. So part of what's important is getting that information, that motivation to make a change, and then having a tool to move from knowing it's important to making a decision to make an action. So we have a lot of tools, not just our conversation starter kit, which helps jumpstart conversations, but a whole host of resources for organizations like you who are looking to build something bigger. We have resources ready-made, and I'll go over that at the end of the call. And then our third prong, what we really are going to focus on, we know that to bring about national or large-scale change, we knew we needed to organize to reach people where they live, work, and play. And who better to do that than you in your own communities? And so we are really here to support through phone calls, through conversations. We are helping to support you all in doing this work within your own communities and reaching the diversity within your communities. Many community leaders like yourselves were looking for help in bringing the Conversation Project and the importance in conversations and actions into their communities. And so what we produced, based on a lot of learning from the field and a lot of organizations' lessons fed into this, we produced our Getting Started in Communities guide. And so this guide is something that we walk through on one of our other calls. So we host a Community Planning 101 call that really goes more in depth into the background of the Conversation Project and then runs through this Community Getting Started guide. So we're not going to do that today, but this is kind of where the interest for this call stemmed. This guide really offers a roadmap on where to get started. And what we do is we walk through basically 10 questions to help you think through how to get this started in your community. If you're interested in learning a little bit more about that guide and walking through these 10 questions, I would encourage you to join our call in June, and I'll get to that at the end of this call and just remind you. But we have a June call that'll walk through that. These are the 10 questions that we walk people through in that guide and on that call. And today we're really going to go deeper into who else to connect with across your community to do this better together. And we're going to learn directly from 3 groups as they share their lessons. And so we start with, who do you want to reach and by when? So really thinking about and getting a little bit more, rather than looking at, I want to do everything for everybody, who is it specifically, and setting up an actual aim. We then go into, what do you want to support them to accomplish? So what actions are you hoping to support them to take? And then how do you want to reach them? Those are kind of the crux, the 3 main questions. But as you're thinking about that, the key questions and what this is really all about is, who else can we be working with? Who else is already doing this work in the community? And so we want to dive kind of into those 2 questions today. So what we're asking you to consider is organizing as a way to make the change needed to advance conversations about end-of-life wishes and advance care planning more broadly. We're about the conversation, but this is one step in a whole host of actions for advanced care planning. And so I wanted to share this diagram that comes from the Institute for Healthcare Improvement, hosts a virtual course twice a year called Leadership and Organizing for Change. And I really like this diagram, which basically is uses organizing as a theory of change. So when I say theory of change, if we do X, we'll get to Y. And so really it starts with people, developing relationships and connections to develop joint leadership, which in turn then builds a collective community that creates power together. And it's not power over something in the traditional sense of power, but really collective influence to then tackle the challenges that you want to face. And in our case, changing the norm and culture of end-of-life conversations. So that's kind of the steps of that theory of change to lead to transformational change. And really what it's all about is people acting together to change the status quo. And so as you think about what you want to do and think about who you may want to do with, consider organizing as a strategy for your work. There's a great quote that they talk about in this course, and it's either Don Berwick or it's Marshall Ganson. I'm apologizing, I'm not sure who the source of this quote is. But you have to ask yourself, not what I am here to do, but what am I here to be part of? And I kind of really like that framing. So as we think about organizing, it starts with connections. We're going to hear a lot about that today. And some of the examples you'll hear is really all about connections and relationship building. We know that organizers bring together individuals that create that collective capacity that sometimes isn't present when individuals act alone. So we can do a lot on our own, and I know we've got some phenomenal champions here that are doing so much. The thought here is really pulling people together to do something together better. Marshall Gantz, who is a well-known political organizer and is with the Kennedy School of Management at Harvard, the Kennedy School of Government, talks about pulling people together in shared action. And he says it's always going to be better together than individual heroes trying to get the job done alone. And I think it's a nice framing. And really, as you think about this, it can accelerate your success when working together. It doesn't mean that there's not challenges. There's definitely challenges. As the more people you work with, it gets to be challenging to figure out who's doing what and where. But there's all sorts of tactics to help mitigate some of that. So as you think about the highlights today, be thinking about who you might join forces with in your own community. This just offers some examples. This is also in our Community Getting Started guide. I'm not going to go over this, but it's just an idea of who might be out there already and what are the assets already available in your communities. So I'm going to end with one quote, which is one of my favorites from some of the work I've done in other work. This is an old African proverb. If you want to go fast, go alone. If you want to go far, go together. And I think that's pretty much what we're going to hear from these wonderful 3 examples that come next. So let me just take a pause. I'm going to pop over to chat, see if there's anything anybody wanted to bring up now before we jump into our organizations. Matt is saying he'd love to find out who else in Delaware is involved in this. Matt, it's a great question, and at the end of the call, I'm going to share a map that we have some organizations that are putting their pin on that map to help connect you. And then if anybody here knows anyone else in Delaware, definitely look up Matt and chat with him and see if you guys can make some connections. So any connections we can help facilitate during this call or after, that's part of what we're here for. So thanks for asking, Matt. Okay, so I don't see anything else in the chat, so I'm going to jump right ahead. And really what you're here for is not for me, but for these wonderful 3 examples that we have. And first off, I'm going to introduce Andy Engel. Andy is the co-director of the New York affiliate of Reimagine End of Life, and he's going to share all about what Reimagine is. Andy comes with a really interesting background, and I love this. He is principal of his consultancy firm, Pandemonium Productions. In this role, he served as an impact producer and engagement specialist for the New York theatrical release of Wrestling Jerusalem, which is a film about the Palestinian-Israeli conflict. He also worked on an off-Broadway premiere of Old Stock, which is on a refugee love story. So Andy comes with some really great background and very different hats from the healthcare hats that some of us may have. For a couple of years between 2010 and 2013, Andy served as a program officer for the arts at the Foundation for the Jewish Culture. And then he was also assistant curator at the Jewish Museum, where he organized exhibitions, public programmings, and the New York Jewish Film Festival. It's a mouthful, in collaboration with film at the Lincoln Center. So I'm just really excited to now pass the ball over to Andy and have Andy share with us what he's been doing with the Reimagine and the work that they've been leading there. So Andy, I think I've passed it on to you, and you can take it away.
Thank you, Patty. After hearing your presentation about the Conversation Project, I was reminded why it made so much sense for Reimagine and the Conversation Project to collaborate on our festivals. There's so much alignment there with our vision and values. So thanks to all of you for having me. I'm just curious. I'm curious if folks have heard of Reimagine on this call. And if you have, raise your hand using the virtual hand. Great. So Reimagine End of Life was founded back in 2016, and it came actually from the world of design. There's a firm in the Bay Area called IDEO, but they have offices all around the world. And one of the executives of the company asked the question, how can we reimagine end of life? Because it's not going well for poor folks, it's not going well for rich folks, or anyone in between. So they issued a call for proposals. They have these design challenges, and they posed that question, and all these submissions came in, and then it became assembled into a week-long constellation of events across the city of San Francisco, where events took place in hospitals and in public libraries and in galleries and in cinemas, meeting people where they're at geographically, spiritually, intellectually. And it was a big success. People from all ages came, and our founding board chair, who is based in New York, heard about this event that IDEO organized and flew out to San Francisco, attended it, went to IDEO's producer, who they hired, and said, how can we take this on the road? Because these important conversations are not happening. So they made a decision to spin Reimagine out into a non-for-profit, and we had our first festival as a non-for-profit back in 2018 in San Francisco in April, and then in New York City, where I live, in the fall. So Reimagine End of Life aims to transform our individual and collective experience around death, dying, and living. And we take this similar transformational approach, where we take these areas like taboo and isolation and anger, pain and loss, and transform them into something different. And I want to stress, it's not about taking away the pain completely, because as we all know, grief is something that does not go away completely. It transforms into something else. And we are using really a festival-based approach to engage people in these conversations. And we are doing that through 4 pillars. And that includes the arts and cultural community. So as I said before, we work with museums and galleries and cinemas. We work with health and medical communities. And that includes hospices and hospitals, senior centers. We work with the design and technology community. Last year at New York, we worked with several design schools to create studios where students can tackle end-of-life issues, designing products, thinking about how to make lives better. And finally, our 4th major pillar is the faith and spirituality community. We had over 350 events, which was huge back in the fall. And I would say it's our blessing and our curse, because we do want to make sure that this blankets New York City and in San Francisco as well. But I would say at the same time, we ended up with a lot of programming that competed against each other. And we had some concerns about cannibalizing our audience by doing so much. And I can maybe share later like how we're trying to improve that going forward. So we had all these different types of events, as you can see, including advanced care planning workshops, which were led by trainees of the Conversation Project. So you can see that it's important for funders to have some kind of data where you can prove to them that you're making some type of impact. So we did have surveys available prior to events and immediately after events. And you can see we did make some impact, that Reimagine events helped make death an easier topic of discussion. And people, for the most part, had a very positive experience during Reimagine Week. So this is our question. Who goes to Reimagine? And it's everybody. As I mentioned, we're meeting people where they're at spiritually. So as you guys, I'm sure, familiar with, some people are more comfortable talking about end-of-life issues with their pastors. Some people want to hear from their doctors. Some people want find it easier to talk about this through some kind of art activity. I'm sharing this slide here because we found it very interesting that so many young people were attending our events, as well as our older audiences. So here are a few quotes that you can read on your own about Reimagine's impact. I love the one in the center. We were instantly united in the universality of our own mortality. For me, as someone who has an arts background, I find this topic so exciting because it has so much potential for creativity because no one's dealing with it. Before I end here, I still have some time, I hope, to share a few anecdotes about our experiences during Reimagine Week. So I would say that our community organizing approach in a city like New York, which is so huge, and it's in a way kind of crazy ambitious for us to try to blanket a city of this size that's divided into 5 boroughs with 2 staff members on the ground. But we took this bottom-up and top-down approach. So we started really with our own networks, whether that was through ourselves as staff members, utilizing our advisory committee and board members to make some suggestions, and starting from there in this more comfortable place. And then we, at the same time, employed, at least in New York, a top-down approach. So we thought, if we're trying to meet people where they're at, spiritually, geographically, intellectually, who are the large organizations in New York City that have the biggest reach? And it's probably true for other cities in this country as well. We started really with the libraries. New York City actually has 3 library systems. So we were able to connect with 2 of those systems and soon learned that it was a good way to disseminate Reimagine's invitation to participate in our festival, because the way Reimagine works, it's not really curated. It's community driven. So we are inviting people to host their own events, whether you're an individual or an organization, and we provide you with tools and resources and webinars to move you along. So the libraries were a great way to engage passionate branch librarians in various neighborhoods to host events that we, and in this case, we sent out menus to those librarians to select from. Because many organizations come to us or individuals and say, I've got this great program, but I don't have a space. The great thing about the libraries is they have the space to do this. Let's see, trust building. So I feel it's so important to try as much as you can to meet people face to face, doing relentless follow-up with them and being generous with people, because we all get busy and swamped with emails. So I tried as best I could just to keep calling and following up, not with, I would say, everyone, where individuals or organizations where I felt that there was some type of alignment. It was important for us to offer clear messaging as much as we could about what Reimagine is, and I have to give the caveat that we're still a startup. We're only 2 years old, and in many ways, we're still figuring this out. The metaphor that we constantly use on our team is that we're this airplane that's taken off, and we're still hammering down the siding as we're flying. And that can be frustrating as a staff member at times, but it's just the nature of who we are right now. I feel like what has been helpful for us in terms of that clear messaging is investing in really good design to make sure that our engagement collaterals are attractive and easy to understand. So I can offer 2 examples of lessons we've learned in involving faith communities. So we were lucky enough this year to finally connect with a city agency called the Center for Faith and Community Partnerships. They have a clergy council which advises the mayor's office on policy and issues. And we thought that would be a very important group to make sure that we have robust faith outreach. So last year, it was frustrating because the executive director had left and they had no one in place. But we were ultimately referred to that person who is now working at Union Theological Seminary. And lucky for us, Rosemary Lloyd of the Conversation Project had already connected us to Union Theological Seminary. So we got to this person who eventually brokered an introduction to the new executive director who came on board only 2 months ago. We scheduled a meeting, we showed our beautiful video, and then she asked for a proposal, which we've sent. And I actually just spoke to her before this call, and she's very interested in organizing with us a interfaith service and concert, which we hope to realize in June of 2020 when Reimagine returns to New York. The next example I can give is this event that's coming up on June 10th in the borough of Staten Island, which is kind of like the stepchild of boroughs in New York City. I say that because I'm someone who's only been there once before, and it actually was to visit an uncle in a cemetery. It's not well connected to the city. You have to get there mostly by ferry. It was a borough where we only had one small library event last year, and we wanted to correct that. We wanted more robust engagement this year with Staten Island. So we had a wonderful event last fall at Reimagine, an interfaith event at the Jewish Theological Seminary, which is near Columbia University. And they had a panel of different speakers from different faith traditions talking about death and dying in their traditions. And one of those speakers was a Muslim physician named Dr. Khalid Rehman. And we met once, and then I recalled that he was living in Staten Island. So I contacted him, and I asked him for some advice on doing some more outreach in Staten Island. He connected me to a imam at a mosque on Staten Island who eventually agreed to host a engagement event, which is happening in June. And they both provided lists to us of contacts in these 4 areas that we're focusing on. And it's happening, and people are starting to RSVP, so we're very excited about that. In terms of fundraising and the lessons we've learned, we're really lucky at Reimagine because we've been given a 2-year runway by a generous board member to realize Reimagine and try to grow it in different cities. Our goal this year in New York is to raise $500,000. Half of that would be this year, half would be in 2020. We had our first fundraiser on April 10th, and it was a fundraiser. It wasn't any kind of like big gala. It was sort of like a house party where through our board members and through our leadership, we assembled a list of guests and we had our first event. That was great. We are in the process now of hiring a director of development, so fingers crossed on that. And we now have a particular eye on sponsorship. At various different financial levels, you can be a member, you can be a sponsor of Reimagine. And we've been coached by a consultant that when me and my colleague on the ground in Reimagine are approaching programming partners, we should also try to assess whether or not they would be open to also being a sponsor of Reimagine. So that's been ingrained in us to try to make sure that's part of the conversation when we invite them in as programming partners. So I think I may stop there and take questions if anyone has them.
Great. Andy, thank you so much. You've given us a really nice flavor of Reimagine and the potential of all the lessons learned. I'm going to ask if anybody has questions, thoughts. For those that have noted that they've been seasoned, maybe there's something resonating that sounds familiar that you've been through. So go ahead and pop that in the chat button. While you do that, I just want to thank you, Andy. You've given us a lot of really good lessons in terms of really from the very beginning, so attending the initial IDEO engagement really sparked that motivation for action. And I love how you talked about the motivation for action then turned into a larger programming where you offered a diversity of offerings, recognizing that there is no one size fits all. You also shared a lot of really great lessons on tapping connections. So focusing not just on the bottom down, top down, bottom up, both sides, and really tapping into existing networks and connections. And I think that has really resonated in a lot of what you're saying and some of the examples from the Staten Island example, from your faith example. You also talked a lot about, and what I love hearing, is just that building trust and being generous with people through the one-on-one connections that you had and understanding what different groups bring. So library brings space, another group might bring food. I love how you share some of that. So let me pop over to the chat. So I see some folks are jumping in. One of the questions is, do you have any plans to bring Reimagine to Boston?
It may have come up in conversation, but right now the major talks are around Cleveland because there are major donors on the ground who want to bring this to Cleveland. That's really what it takes right now, is that we're still a small organization. There's just 2 of us in New York. The rest of the team is in San Francisco. There are about 4 of them there, and it's growing incrementally. But it takes a lot of capacity building for a city to bring a Reimagine, and that requires local funding.
Yeah, well, and hopefully this is sparking some ideas here. I'm reading the questions. I recognize, Andy, you've been doing a due diligence and answering them in the chat, but just for those who aren't on the computer, let me just read some of the other ones. So one of the other questions was, Gloria was wondering if she's correct in believing that advanced directives are the primary focus of your efforts. Andy, you mentioned that advanced directive is not the only focus. Do you want to talk a little bit about that?
Sure. Certainly, I think, for us, for folks even just to begin the conversation with others about values clarification, with their loved ones, that's one step forward towards preparation. What I neglected to provide all of you was that there are 3 major thematic areas of a Reimagined festival. One is wonder. We're interested in those big existential questions about what's going to happen when we're gone, and how can we live fully now. The second major area of Reimagine's focus is remembrance. We know that people are coming to Reimagine events and they're holding someone in their hearts, or they're holding a collective community in their hearts, and they want some form of expression to remember lives. So much of our programming is focused on that. Just 2 weeks ago, we had one of our first year-round events, which is something new for us. We don't want the sparks of a Reimagine festival to die out completely. We want to sustain them through ongoing engagement with our collaborators and with our audiences. So we partnered with a group that we worked with last year. It's a small art gallery, and they were organizing an exhibition on the topic of grief and all these artistic responses to it. So they reached out to us to see if we would want to partner with them on a public program, and we ended up doing a panel discussion on memorials and how memorials are changing these days, and how designers and artists are coming up with really interesting innovative ideas on how we remember communities. And then the third and final thematic area is preparation, and that's where advanced directives come in and advanced care planning. Those are the three major areas of Reimagine.
Great. Thank you so much, Andy. Any other questions coming in, we're going to just have you go back to the chat. I know Mickey has a question, but just in the sake of time, I think we're going to move on. But Andy, thank you. And it was clear, some of your other messages too, clear messaging is important. I love how it's not just about the documents, but all of those conversations and wonderment about that surround before you get to that point. So I love how you've combined those three pillars. So Andy, thank you so much for sharing. Andy's providing more information, the website there, and you guys can continue to chat in the chat button. And I'm going to move on to our next presenter. So thank you, Andy.
Thank you.
Okay, so I've got a tag team effort here from the South Carolina Coalition for the Care of the Seriously Ill. And I'm really excited to have both Marisette Hassan and Dr. John Ropp here with us today to share a little bit about their work. And I'll just give a brief introduction to both of them and move on to them. So Marisette has worked professionally as a nurse since 1981 in a whole host of roles, and I love seeing her background. Marisette wears a tremendous number of hats. In her nursing role, she's been in oncology as a hospice nurse, as a home health and hospice administrator, clinical manager. She began her tenure as the vice president for the South Carolina operations for the Carolina Center back in 2014, and is now serving as president and CEO for the Carolina Centers. They've been a tremendous partner, and we've learned so much from the work that they've been doing at the Carolina Center. She's also a certified end-of-life nursing education consortium trainer, so ELNIC, the group if you're not familiar with them, as well as a Respecting Choices facilitator. So I see a couple folks on the call that are just new to Respecting Choices or are already facilitators. So we've got some great connections there. She also serves on what I'm really interested in learning more about is the PCORI grant around investigating how to improve advanced care planning for African Americans. She chairs the My Life, My Choices program, which you'll hear a little bit more about. And I'm going to stop there because I could go on and on, but Marisette is bringing a whole wealth of information. And then we have Dr. John Ropp. He is the chairman of the South Carolina Medical Association. He's a board-certified family medicine practitioner with a certificate in hospice and palliative medicine. So brings a lot of experience from his work as a practitioner. He's also the chairman of the South Carolina Care of the Seriously Ill. So really a lot of experience around bringing this coalition together. And we're going to hear a little bit more about the coalition, which aims to give an active voice to patients and families through advanced care planning and other initiatives. So I'm just welcome both of them, and let me know which one of you is going to kick us off.
I'll be glad to, Patty. Thank you so much for that. Can you hear me okay?
Perfect. Go ahead, John.
Great, thanks. And Marisette is actually right now in Massachusetts. I'm in the upstate of South Carolina. I'm getting ready after this phone call, in fact, to pack my daughter up from her first year at college. So I appreciate the chance to jump on this call before I have to do any of the hard lead work the rest of the day. But the Coalition for the Care of the Seriously Ill is a coalition. It's a statewide initiative. And it started in 2010, and it's really the outbirth of many organizations. All of y'all can go back to 2010 in your time capsule and think about what was going on then. Well, President Obama was in office, and his priority was Obamacare. And, of course, it passed as it did. And it's at that point in South Carolina, which, by the way, is about 4 million people, the entire state. So whenever I hear Andy talk about the Bay Area, New York City, even places like Cleveland and Boston, the size of our state is very manageable whenever you talk about the things that we're talking about here. So Andy, I applaud your work and what you're doing and tackling in the cities of our nation. Very much needed, and you would be commended for your work there. Here in South Carolina, we're in many instances a community in and of itself. We have various places across our state, but in one sense, we kind of know each other. We know who we're dealing with, and we know the health systems that are involved. And so going to that second slide where we asked the question, how did CSI become an effective coalition? Well, when Obamacare passed, the hospitals, the physician groups, the end-of-life care groups, nursing, and others, chaplains, even our South Carolina Bar Association, which is our lawyers, came together and said, we need to be sitting at this table. And that is something that had not been done in a very, very long time. So it was through those processes that we sat together and said, what are the things that most impact patients? And so obviously
Joe,
around—
can I interrupt you? I apologize.
Of course.
I'm not sure if we're able to advance a slide because you have the ball.
I have the ball. Can I pass that ball on to someone else?
Yes, you can. If you want us to advance the slides, perfect. Okay, just let me know when you want me to advance the slides, and then you can go ahead. Sorry about that.
Perfect. Thank you. I see that you have that ball now. So are we on the effectiveness slide?
Yep.
Great. So there you see listed 6 or 7 different things that allowed us to become a coalition. And Marcette, if you're able to take over from here, and we can kind of work on this slide together, because I know a lot of these are suggestions that you and I have talked about for a long time.
Yes, as this work started back in 2010, can you guys hear me?
Yep, sounds good.
You sound great.
Okay. I think the thing that was most important for us was really to recruit champions. As you heard from Andy, those people who really have a passion and desire for the work. And we weren't just looking at clinicians, but also looking at bringing everyone to the table, that this whole thing of serious illness, those individuals could be touched by it. So providers, post-acute providers, payers, consumer advocates like AARP, one of our core partners. We needed to make sure that we had everyone who was in this space involved and engaged. We put together a structure that would promote that engagement and that participation. And we meet regularly, about every other month we meet, so about 6 times a year. And then our committees work, doing the committee work as well. Collaboration and consensus, it does take time to build trust. And of course, we've started about 8-9 years ago, and we really were tested with our collaboration and trust when we decided we were going to apply for a grant, and we had to put all our cards on the table in terms of how we were going to work together with our advanced care planning initiative. And so it's very important to have a consensus-driven approach, and that has worked well for us. We've got commitment from core members, and that commitment to me is amazing. Many of our core partners either commit to the meeting space, or they commit for doing the minutes, or the committee time takes a lot of time to work with the committees. And so that commitment at a high level has really allowed us to be successful. Those in-kind support, AARP, one of our members, does a lot and allows us to really talk about these issues with teletown hall meetings, and offering that as an in-kind support to the work that the coalition is doing. Others are doing educational events, and so that is key. Funding has been very important, and with our grassroots initiative, getting the funding from Blue Cross Blue Shield has allowed us to do a pilot in underserved communities, and that has really helped us with some early success. And then through those initiatives, the community engagement with partners across our state in some of our regions, and they are reaching out to the faith communities and working together with diverse groups. And I think it's also always, finally, I would say that we also always have to sort of identify and have transparency address any conflicts of interest. As soon as we identify that there's something that could hold up our progress, we try to address those things pretty quickly and don't let those things sort of linger on. So those are some of the things that we have learned over the last, I would say, 5 to 7 years in the work that we've been doing. And so, John, I'll turn it back over to you.
Yeah, thank you, Maricette. And you're absolutely right. I think bringing those champions together from the different organizations has been the biggest key. Up until this time, we've had a number of initiatives, and so I want to go into the next slide. We can go straight into, if that's okay, Patty. This is our coalition's history and timeline for really a couple of initiatives that have been to the forefront of our group over the last couple years. As we stated several times, we started in 2010. It was established then through different stakeholders coming together. And we had initial trials. Now, the Pulse paradigm came kind of late to South Carolina, and it was our group who picked up the effort and began really around 2014 with the pilot stages, and then moving on there with developing strategic planning for an initiative that would eventually lead into our advanced care planning initiative. Maricette also mentioned, key point was the awarding of a foundation grant by the Blue Cross Blue Shield Foundation of South Carolina that would advance this planning initiative. And that started in late 2017, and really the first half of 2018 is when it got off the ground. Eventually, through many different iterations, post-legislation was introduced, and this was driven exclusively by members of our coalition. What we have found is that whenever you have multiple organizations, then within those organizations, you not only have administrative structure, built-in leadership, regular places of meeting and other support, but you also, importantly, you have legal structures already in place. So that's where our lawyers, our lobbyists, those who know their way around the politics of different things comes into play, and that's been very vital for us. So what that has led up to in this past legislative session that began in 2019 is the passing of post legislation. It requires one more signature, and post will be law. And the word we have right now, fingers crossed, is that it will be passed next week. So we're very excited about that, and look to see how that can be engaged in further initiatives. Next slide, please. Maricette, would you like to begin talking about the My Life, My Choices?
As John shared with you, one of our initiatives that we received $1.8 million for at the end of 2017 was an advanced care planning initiative in rural and underserved communities. And so with engagement with the community and doing focus groups, this initiative was named My Life, My Choices. This particular initiative really focuses on number one, education, and that is education with consumers and raising awareness, clinician education, because we know from research that a lot of our clinicians are not comfortable having these conversations. And then a technology component where in South Carolina we don't have rapid access to advanced directives. So we're going to pilot an e-registry in those with those community partners in the 5 communities. So we have utilized using information from some evidence-based teaching tools that are out there already. Respecting Choices was one that we used to train our community organizers to get them comfortable in understanding advanced care planning. We have done a partnership for the faith communities with the Conversation Project and did some training with them. And as well as you can see, those are some of the key partners that are there. But this initiative, since last year, we have talked to 4,000 community members, educating them on advanced care planning and the value and the benefits of starting to have these plans early. There have been more than 400 clinicians that have been trained. And so we're excited about that. And there are also more than about 200 advanced directives that have been initiated. So a lot of good work. Considering that we just kind of got everybody moving in July. We're not quite 1 year into this grant initiative, As you can see, where our core partners are, the 5 key geographical areas for areas that our funder does a lot of support in underserved communities. And so as we vetted and these partners submitted their applications, these are all areas that were considered rural and underserved. Back to you, John.
Thanks. And, you know, earlier in his presentation, Angie mentioned the fact about who was invited to the meetings and to the groups, and we couldn't agree more. Everyone's invited. Whenever we think about that underserved and vulnerable populations, we're always laugh among ourselves because one of the Blue Cross Blue Shield insurance side members always reminds us that when it comes to advanced care planning, everyone is underserved because it's just something that it's not that hasn't become in the medical jargon. As a medical physician, I did not receive any formal training on advanced directives even. That didn't occur until residency program. And of course now with the emergence of the healthcare power of attorneys and also the post-like documents, it's something that we engage everyone as much as possible. So as far as the next steps, everyone's interested in how coalition work evolves. It's one thing we always ask ourselves, and it was on one of the earlier slides about, we're always asking ourselves, who is not sitting at the table of this coalition, and why aren't they here? What can we do to light a fire underneath those groups that aren't quite as engaged? And we recognize that organizations do evolve as well, and so we have to be patient. And so it does take a lot of time for these things to come about sometimes, and that's okay. We want to be intentional. I think, Patty, what you said earlier about the African proverb is very appropriate. We've seen even some of our states to the north and south of us who have sometimes rushed into their post legislation, and we took a lot more deliberation on that and took it a lot slower, and we built a coalition around that, and that's why we think it's been successful and will continue to be. But as far as sustaining our own coalition is always something we think about. We think about it every time we meet, in fact. One is right now we're formalizing a CSI structure so that it can be more likely to receive grant funding itself as opposed to relying on this organization this year or this organization the next. Going ahead and solidifying that backbone organization structure going forward. Second is investigating grants continually. I know all of y'all do this already, and you're looking how to your funding streams and all. In our state, we do rely primarily on the 3 or 4 things that was mentioned in the second slide. There is the payers, looking for also our own organizations to contribute in-kind offerings. And then finally, our state is blessed to have just a ton of community foundations, many of whom were born out of community hospitals that were founded at the end of the 1800s, early 1900s. Many of these were founded by physicians themselves or by church organizations and carried those names for many, many years. Well, over the last 25, 30 years, many of these have been sold to other hospital systems that have merged. Y'all have probably all experienced that yourselves. And that has created foundations. And those foundations will be a source of grants and streams of income as we go along. Also getting the funders to look at projects like the advanced care planning initiatives and say, you know, this group and that group in the state are kind of working on the same thing. They may have a little bit different perspective on it and how they roll it out. But what we found is even with CSI, we had 2 or 3 groups working on an ACP project. Blue Cross Foundation said, wait a minute, we're getting requests from this group, this group, and this group. Why don't we get you guys in the room together and let's work together on something that's more comprehensive, and that would be almost a model that can be used across the state. And that's what's going on with our My Life, My Choices initiative. We want to continue to align with key partners. That's, again, asking the question, who's not with us, and how can we make sure that that we can help them, they can help us. And then above all, maintaining that core mission to be to protect and to look out for the voice decision making for all persons across our state. So that's kind of in a nutshell the coalition. The work goes on and will continue to do so. So Patty, thank you for allowing us these few minutes to share this. And we're certainly open to any questions now or whenever it seems to be the best time.
Yeah, I would ask you if you could sort of go back to the next slide. And I sort of summarized that, but I did want to have folks see some of the other data in terms of ACP conversations that have been conducted since last July, and also to see that with the education and sort of the consumer awareness, we're finding more and more people are willing to have these conversations, and that our health care professionals are expressing a greater confidence in conducting the conversations as well. So I just wanted to share that when we educate, that when we engage people in their communities with people that they're comfortable with, we're seeing that we're making a difference. So
that's wonderful. Thank you. Maricette and John, I just want to thank you both. This has been really a rich set of learning that you shared with everybody. Go ahead and anyone who has questions, go ahead and pop that in. I think this last slide that you also focused on, you shared this, kind of is that head and heart. So the stories are so important. The community members that you're bringing in are so important, in addition to the results that you're showing. And I think that's also shows both sides that will help with the funding. And I love the examples that you gave for funding. I'm going to look to questions, and then I can go back to some of these key points that you guys made, and then we're going to move on to Mickey. So Gloria is asking, in looking for appropriate sources for grants, what would you Google, or where would you look? Such a great question, Gloria.
I put also, we have a website that we've developed for this initiative, so I've popped that into the chat. But for looking for funding, we started first with those individuals, as John mentioned, in our state. We knew that Blue Cross Blue Shield funds a lot of work related to healthy initiatives. And we also have another funder in North Carolina. So looking at your own backyard first of folks that support the kind of work that you want done. And this was a new initiative for our funder. They'd never funded an advanced care planning initiative before. And so that was really our first step. And then I think, you Google advanced care planning, you Google racial, grants that can support disparities. That's another area, as I'm involved with another grant with Dr. Kimberly Johnson, which is Equal ACP. It's a PCARI funded grant, and they were looking for someone to really look at reducing disparities. So that's another area that you could consider as well. So.
Great, thanks, Marissa.
The Hospital Association sometimes comes across grants that work for us as well, and so lean on your partners of the things that they have heard about as well.
I love that, and that's where that coalition building, the recruiting champions, comes into play. Different people may have different ideas or that's networks that you're mentioning. And so I know that's a $1 million question. A lot of people are thinking about how do we get funding. So I really appreciated looking to community foundations, looking at your payers. You guys provided a lot of really good overview of the commitment that's needed, the shared purpose that you created. Lindsay has a question, and I'm going to ask you guys to just do a real quick touch. We won't get into this just in the nature of time, but she was just wondering, what did your provider training look like, and how receptive were physicians to being trained in this? So just briefly.
Real quick, we chose to go with the Serious Illness Conversation Guide training that is done by Ariadne Labs. And so it's evidence-based. It's only about 2.5 hours. It's interactive. And our clinicians have been very receptive to it because it can be done in a short time frame. And the feedback we're getting has been very positive. So we partnered with Justin and his team there. We came and trained our core folks, and now they are training others. And as you can see, it's going well. So
that's great.
Go
ahead, John.
Just to piggyback on back, I think whenever you're trying to get physicians trained, it's got to be something that's very concise. It's got to involve other providers within the healthcare system network. And also, the return on investment has to be pointed out, and so we constantly refine our messaging for the physicians.
Great, thanks, John. I went ahead and popped in. It's called the Ariadne Serious Illness Guide. Nancy will provide a link to. We have that guide, which then takes you to their site on the Conversation Project web page on our healthcare resources. So Nancy will pop that in for you guys. So in the matter of time, I want to move on, but I really want to thank the two of you for sharing a lot of the lessons learned. Patience, the long runway really pays off, and even in 1 year, just really a huge congrats on what you've accomplished since July. So thank you both for sharing, and appreciate the connections that we've been making.
Our pleasure.
Great. So we're going to move on and shift gears, and we're going to really go down to the grassroots individual level. And I'm really excited to have, as a third example, Nikki Jackson, who is going to bring her experiences as an advanced care planning advocate, volunteer, and a lifelong grassroots organizer. Nikki is a lifelong advocate for peace, justice, equality, inclusion, and equity, and I love her focus. In addition to her work in improving healthcare, she's also a member of the Friends Committee on the National Legislation of Bellingham Advocacy Team in Bellingham, Washington. And really, Nikki's going to share a little bit of her story on why she does this. She honors her husband every single day, and his memory lights her path when things look bleak. And that's what she shared with us, and I love that, Nikki. She believes that young people are the future, and we should never lose sight of our responsibility and obligation to honor them through our actions. So let me pass the ball over here. Hold on 1 second. Sorry, Mickey, I'm trying to get this ball down to you. All right, I've passed the ball over to Mickey, and Mickey, take it away and share your example with us.
Thank you, Patty. As you see, I'm here in Bellingham, Washington, and to put it into context for those who are kind of geographically far-flung, Whatcom County is right up against the Canadian border with British Columbia, and Whatcom County is probably unique to many of the people on this call because there's only one hospital in the entire county, and that's Peace Health St. Joseph Medical Center. And Peace Health has hospitals in Alaska, Washington State, and Oregon. So the way I got started in this advocacy was through being a caregiver for my husband during his disease process. And I could see early on that outpatient palliative care would be an enormous help if we had had access to that kind of model, but we didn't. And I feel that advanced care planning and outpatient palliative care, or even inpatient palliative care, go hand in hand. And so after my husband died, I decided to look for ways to make some of these things happen in our community. And I was sort of one woman on a mission at first. And I started out by going to the Bellingham Senior Center to see if there was anything I could do there. And there was, and I helped with a wellness event. And I wanted to have, as one component on the program, information on advanced care planning and palliative care. And I was told in no uncertain terms, no, because the thought was that people wouldn't be interested in that. But that didn't deter me. But the first time, that did not get on the agenda. And then not too long after that, I saw a notice in the newspaper that there are 2 ICU nurses from St. Joe's Peace Health were going to give a one-time presentation at a senior living facility here in Bellingham. So I went to it thinking, well, I'll see what they have to say. And so I went, and there were only 11 people in the audience, but I was just amazed at the message that these two ICU nurses gave to the small gathering. And so afterwards, I approached Koala and Kathy, and I asked them if they were willing, if I was willing to go out throughout the county and try to generate interest in their talk and book a venue and promote it and so forth, if they would be willing to work with me to get this message out. And they looked at me like I was kind of crazy, but they agreed to do it. And so the presentation is titled The Realities of Advanced Medical Intervention. And it's actually a presentation that we viewed as, first of all, it supports really good decision making before an accident or illness occurs. And the presentation is a conversation starter to help people, prepare to talk to their family and their providers, their doctors and so forth, about what they might choose or not choose if they could no longer speak for themselves. And so I booked Koala and Kathy's presentation at 48 different times in about 2 years, and they were all to capacity audiences, and they were at a variety of venues, ranging from libraries, a synagogue, the Whatcom Peace and Justice Center, Whatcom Dispute Resolution Center, various churches, the Lummi Nation, and we also gave the program at the 3 nursing schools here in Bellingham, at Western Washington University's RN to BSN program, and then at Bellingham Technical College and Whatcom Community College Schools of Nursing. And some of these were repeat performances. And with each presentation, we became more and more aware that this talk in and of itself was really creating a lot of interest by word of mouth. And so then different organizations and individuals started coming to us, or mainly to me, because I was the agent, as we called me. And anyway, we eventually discovered that one model that we should work with was to present realities one week, and hopefully the next week, but no later than 2 weeks later, have an advanced care planning workshop to follow up. And that model has been hugely successful in completed documents. And so that's one thing that that I got started here in the county. And that eventually resulted in like me being notified by the Rotary Club of Bellingham, and the program chair there, who happens to be the Whatcom County Medical Examiner. He contacted me and he asked if I would help him put together, he thought maybe a 4-week series. They met every Monday on a program that he called Contemplating End of Life. And I readily agreed, and I said, sure, I'd be glad to help you with that. So I said, 4 weeks? And he said, well, longer if you want it. Well, it ended up to be 13 weeks. And Gary, or Dr. Goldfogel, the Whatcom County Medical Examiner, he told me, he said, well, I'm getting a little pushback from the members. They think, well, do we really want to hear about, contemplating end of life for 13 weeks? And anyway, because they're Rotarians, they showed up. And as the weeks went on, more and more people from the community were attending the presentations. And about, halfway through the program, or the series, a man here by the name of Mike Deal, who is one of the owners of Deal, the Deal Ford dealership, came up to me and he said, you know, many of us were skeptical about this information and this program. He says, but I want you to know that now I know what I didn't know is what I need to know. And he said, this information is so important to our loved ones and to employers, to our doctors, to nurses. And anyway, our community is really receptive to this when initially they weren't. And to me, it didn't take that much time to move them forward. And one of the, you know, earlier in the in this webinar, I think it was Patty who pointed out that storytelling is very important to you know, success in this kind of effort. And one of the things that I proposed to Peace Health and the Palliative Care Institute, which is at Western Washington University, and to Whatcom Alliance for Healthcare Advancement, I proposed a program last year for National Healthcare Decisions Day called What's Up, Doc? We're Dying to Talk. And one of my goals was to generate interest among young people to attend. And so I raised $7,500 and divided it into 5 $1,500 scholarships that would be used as door prizes for college students who attended the event. And people were lined up outside the door, and it was a, you know, an overflow audience, and it was just fantastic. But the program was designed around what I called an intergenerational conversation. And so I recruited a speaker from every decade from 20 through the 90s, and people shared a 7-minute story about you know, an experience, a thought, a success, whatever it was that they wanted to tell in their 7 minutes. And people were laughing, they were crying, and they were totally engaged, and it was a huge success. And so that was one sort of event that that I conjured up and not to boast, but made happen. And then so this year, surrounding National Healthcare Decisions Day, I had proposed another idea to Peace Health as the only hospital here in town. I suggested that they adopt what I called the I've Got Mine campaign. And the intention was to recruit people from the community, and from the hospital and from clinics throughout the county, and I've got the mayors of the major cities in Whatcom County: Bellingham, Ferndale, Linden, Blaine, and what's the other one? To participate in the I've Got Mine campaign. And the object was for each person to hold up their advance directive and point to it and say, you know, I've got mine. Well, Peace Health, St. Joe's, put up a display leading into the cafeteria throughout the month of April, displaying all these people who had participated in the I've Got Mine campaign. And the feedback on that has been uniformly positive, and they're going to probably use the exhibit again at, you know, the clinics around the area. Another thing, as far as going back to the realities presentation, our hope this year, or hopefully no later than next year, we'll find a presenter to translate the presentation into Punjabi and Spanish, because we have large Sikh and Spanish-speaking communities in Whatcom County. I'm kind of jumping around here, but another thing that happened because it's a grassroots effort, Providence Health Services, they heard about the I've Got Mine campaign from somebody on Vashon Island, who's a friend of mine, and so Providence adopted the I've Got Mine campaign for Providence, Southwest Washington, and I believe that they're going to use it throughout their system also. Let's see, what are some of the other things that have happened here in Whatcom County? Well, you know, because it is about stories, one of the things that I really believe in is the power of the pen. I come from a family where in a couple of little towns in the Midwest, my grandparents owned newspapers. And so I believe in writing letters to the editor about, you know, any given topic that that's important to a community. And I can't always get published myself, so I recruit other people to write letters to the editor. And that's been very successful. And one other thing that I think is important for everybody is that I find that sometimes I used to think, oh, I can't ask for that. And then I thought, yeah, I can. I ask for something even if it seems very unlikely that I'll get a yes, because I'm always surprised. And so with that, I think that my time is running out. But anyway, if you have any questions, feel free to email me directly or ask them now if there's time.
Super. Thank you, Mickey. We do have time, and I'm going to ask if you have any questions or thoughts for Mickey. Go ahead and pop it in the chat. Mickey, you have shared a wealth of information that was really driven by your experiences, and I appreciate you sharing your story of self and your experiences with your husband that really led to driving to combine forces with the nurses that you mentioned. You all created a variety of venues, but also I love the diversity of the population and audiences reached through the venues, but also through the types of programming you had, through intergenerational conversations. And I love the snowball effect of the work that you've done. You all set out some clear roles. I heard when you said you were the agent, it just triggered that it's really important when working with others that you have clear roles and delineation of who's doing what. And so I think you have some folks on the chat who are interested in collaborating. So Gloria may want to connect with you. As she was mentioning, she lives in St. Louis, and this is what it's about, is making those connections. Carrie has a question, and the answer is yes. Carrie asked if you could share your presentation materials. Well, sorry, Carrie, I'm saying we can share this presentation. If you mean Mickey, maybe you can be more specific the ask that you're asking, Carrie. we'll have these slides available to everybody. We're going to forward them out again after the call. And Mickey has offered up her email there to connect. Any other questions or clarifications from folks? As I'm waiting for anything that's coming in. Okay, so for the presentations, Mickey, that you're doing, Carrie's asking if you could potentially share, and it looks like you guys are going to connect over email, which I love to see. So thank you, Mickey, for sharing this. I hope some of what folks are learning on the call today resonates, because we've had, from Mickey's example on the ground to a cross-state coalition, to citywide events, but obviously the population of New York, as John was pointing out, is different than South Carolina. So we've had a wide variety of who's being reached. So Mickey, let me go back to you and thank you very much for sharing.
Well, you're welcome.
Great. So any other thoughts? We have a couple more minutes as I wrap up, but I wanted to bring in any other questions or thoughts that folks had. I apologize that the time is running short. We have so many good examples, but if we don't get to things today, we definitely will keep connected. We have follow-up after this call through, we'll send information out, and if there's any questions that you have, we can loop back around to the presenters. So definitely feel free to throw in any questions or comments in the chat. I'm just taking a peek at this and seeing if there's anything else here. Matt has mentioned, is there a way we can find out who might already be working on this in our area? It's a great question, Matt. So let me go through some of the resources that we have for you and offer up our champions mat, as I mentioned before. You can also get in touch with us, and we can see who we can connect you with, because not everybody who has been doing work is on our champions map. There's a whole host of organizations. So feel free to contact me. Naomi can pop my email or our general email for Conversation Project. You can connect with us. We are always really interested in making those connections, so we'll do this on the calls, and we can do this outside of the calls. Thank you, Naomi. Mickey, let me ask you if you could pass the ball back over to me, and I'm going to just move through some additional slides. You just need to, yeah, there we go. Thank you so much. Okay, so in the last couple of minutes, I'm going to cruise through some other resources that we have. If there's anything else you want to connect about, keep going in the chat. I'm going to share this example as another example of some work that's happened this past April in Boston. The Boston Theological Interreligious Consortium pulled together a lifelong learning conference that was co-sponsored by several different organizations and really had a great structure to reach clergy in formation. I'm going to leave this here. You guys can click on the link below. Right down here is a link to an article that talks all about this, so you can learn more about that, and you can connect with us if you want any more information. Just another example of multiple groups pulling together for information and action as they shared tools. They shared some motivational pull and worked with a couple different groups came in. So as I mentioned before, we have our series of calls. So if you haven't been part of these calls and want to continue, first, I encourage you to sign up for our newsletter if you're not on that already. But second, these calls, you can go to our website, and every month, the third Wednesday of every month, we have these calls. So I mentioned we'll go more in depth in that community guide on our call in June when we talk about Community Planning 101. In July, I'm really excited to have lessons learned. The Massachusetts Coalition for Serious Illness Care is gathering tomorrow to share the results of research that they've been doing around messaging for end-of-life conversations and advanced care planning. They're going to be our guest in July to share those lessons with our group. And you could take some of those messages and adapt them to your own work. And then in August, we have a call that is really going to be talking about Conversation Sabbath, which is a time for different faith communities to unite and preach and teach about the importance of conversations. In addition to those calls, if you go to our Get Involved page, the link down here, we have a Conversation Champions map that have this whole host of organizations already on there. Please take a look, because you might see who is in your state and in your network. If you don't see someone, feel free to contact us. If you go to our Get Involved page, and you'll see these three: healthcare, faith, and community. These are resources for those different areas and a whole host of tools that are already made that you can take, use, adapt. They're all free, and we want you to just get as much as you can out of what has already been created. Bear with me for just one more minute and I'll wrap up the call. At the end of the call, when you exit, if those folks have to go right now, we're going to ask for a real quick hit survey. Feedback is so important to us, so if you can take just 2 minutes to answer the survey that you'll be directed to, I'd appreciate any feedback you have. For those who can stay for one more minute, this is just a list of some of our new resources that have come up. We're really excited to share a guide on how to talk to your patients about end-of-life care that offers persona-based learning based on 4 case studies and 4 different types of individuals, and really serves as a toolkit for clinicians on how to ensure that you are respecting patients' wishes and initiating conversations in the healthcare setting. We have a compilation blog that just came out that has 6 go-to healthcare resources that includes that toolkit, but also a couple motivational videos and stories that people have shared with us, in addition to a white paper that was recently released as well. So I encourage you to go and check out those healthcare resources. The white paper is on Principles for Conversation Ready, how healthcare organizations can respect those wishes. And then we have a recap of other new resources through the Conversation Project through this link here. It's in our newsletter and on our website, so you can find new resources really easily. Let me see, the last quick thing, we have a letter writing campaign. You can check that out on our website as well, encouraging folks to write letters to their loved ones about what matters most. And we have a whole host of examples that you can tap into. And with that, I know I'm going pretty quickly at the end. Want to thank you all for joining us. Huge thanks to our presenters for being here with us and sharing their lessons learned and getting the connections going. Again, if we can have a few minutes of your feedback, that would be great. And just a quick thanks and appreciation to our funder, the John A. Hartford Foundation, who makes these webinars possible. We hope you will join us next month and continue the conversation. And any feedback or information, please definitely get in touch with us. It's really important. So with that, thank you. I'll close off our phone call, and thanks for sticking with us to the end here.